Most of us are used to the electronic conveniences of modern life. However, very few of us are actually aware of the possible health risks that it poses. Technological advancement played an important role in modern day medicine. Medical technology has made a significant breakthrough in improving our health while at the same time prolonging our lifespan. Electromagnetic field, or EMF for short, has found its way into medical practice for quite some time now, and some of the most well-known applications of EMF in the medical field are magnetic resonance imaging, or MRI, hypothermia treatment for cancer, implants, and so on. Although most researchers don't believe that EMFs are dangerous, there are scientists that question the safety of prolonged EMF exposure, since there hasn't been enough research into whether it is truly safe. So, what are your thoughts about this, Mr. Rushdie?
Okay, thank you, Mr. Moderator. For me, I'm firmly believe that the prolonged exposure to EMF can pose a potential high risk. While EMF have found a valuable application in various medical practice, we must acknowledge the need for further research to ensure the long-term safety. Firstly, let's consider the effect of magnetic resonance imaging (MRI). Although MRI is widely regarded as a safe diagnostic tool, it involves exposure to a strong magnetic field and a radio frequency radiation. Some studies have indicated that the individual working in close proximity to MRI scanner may experience adverse health effects, including dizziness, headache, and cognitive impairment. While this effect may be temporary, they warrant further investigation into the potential long-term consequence of prolonged EMF exposure. Additionally, let's explore hypothermia treatment for cancer. Okay, while this therapy shows a promise in targeting cancer cell, it also exposes the potential to elevated cell of EMF. Research suggests that the EMF can induce the biological effect at the cellular level, potentially interfering with the normal cell functions and DNA repair mechanism. Okay, this finding raises a concern about the potential chronogenic effect of EMF effect and the need for more comprehensive study to assess their safety. Furthermore, there is evidence to suggest that the certain medical implants such as pacemaker and neurostimulator can be adversely affected by the EMF. Interference from the external electromagnetic source may disrupt the function of this device, posing risk to the patient with such an implant. This highlights the importance of mitigating the EMF exposure in medical setting to ensure the well-being of individuals relying on this life-saving technology. In conclusion, while some research may argue that the EMF in the medical field are not dangerous, it is also crucial to consider the existing evidence that can raise the legitimate concern. The potential high risk associated with the prolonged EMF exposure, as observed in MRI setting, hypothermia treatment, and interaction with the medical implant, demand the further investigation to safeguard the patient safety. Thank you, Mr. Moderator.
Right. I think we really should take into account all the risks as well as the negative side effects that you've mentioned earlier before putting all of our trust into the technology that is supposedly be saving our lives. How about you, Mr. Ayman? What are your thoughts of electromagnetic waves used in medical settings? Do you share the same sentiment as Mr. Rushdie did?
Thank you, Mr. Moderator. I respectfully disagree with concern raised by Mr. Rushdie. While it is important to continue research and ensure safety, the existing evidence suggests that EMF used in medical application pose minimal risk to human health. Let's start by examining the safety of MRI. Numerous studies have been conducted to evaluate the potential adverse effects of MRI on human health. The consensus between experts is that the magnetic and radiofrequency field used in MRI are well within safe exposure limits established by regulatory bodies. Extensive research has failed to demonstrate any conclusive evidence linking MRI exposure to long-term health risks or significant harmful effects. The temporary symptoms reported by individuals working near MRI scanners are often attributed to factors other than EMF exposure, such as high noise level, or anxiety related to the procedure. Regarding hypothermia treatment for cancers, it is important to note that EMF exposure in this context is carefully controlled and monitored to ensure patient safety. Studies investigating the effects of therapeutic EMFs in cancer treatment have not found any consistent evidence of harmful biological effects or increase the cancer risk. In fact, some research even suggests that targeted EMF therapy can improve treatment outcomes and quality of life of cancer patients. As for medical implants, modern devices are designed and tested to withstand and function properly in various electromagnetic environments. Rigorous safety standards are in place to ensure that medical implants, such as pacemakers for the heart and neurostimulators, are not affected by external EMF within the recommended exposure limits. Instances of actual interference leading to adverse events are exceedingly rare. I mean, it's quite very rare. In conclusion, while it is reasonable to call for ongoing research and safety assessment, the current body of evidence suggests EMF use in medical application such as MRI, hypothermia treatments, medical implant pose minimal health risk to patient. The stringent safety regulation and studies conducted in the field support the notion that the benefits of these medical procedures far outweigh any hypothetical risks associated with EMF exposure. It is essential for us to rely on scientific evidence and consensus that consensus for experts that give their facts and their opinion so we can understand the EMF in the medical field are safe rather than harm to the patient. Thank you.
Right. You've raised a lot of good points in your arguments, Mr. Ayman, but you are basically denying any sort of negative implication towards electromagnetic technology. Do you believe that it is 100% safe, or do you think that some improvements can be made to the existing technology in order to help deterring negative perceptions public has towards it?
Okay, I see your point, Mr. Azim. Thank you for your question. I apologize if my previous response came across any as denying any negative implication of AMF technology. While I believe that the existing evidence support the safety of electromagnetic fields in medical settings, there is always room for improvement and addressing public perception. One potential approach to reduce perceived risk is to enhance public education and awareness regarding EMFs in medical field, educating patients, healthcare providers, and the general public about the safety measures implemented in medical settings can help alleviate fears and misconception. Providing clear information about rigorous safety standards, regulatory guidelines, and scientific evidence supporting the use of EMF in medical procedures can foster trust and confidence. Thank you.
Sorry for interruption. I appreciate the point raised by the Mr. Iman. And while I acknowledge the potential benefit of electromagnetic technology in medical setting, it is crucial to take a step to mitigate the perceived risk and improve the existing technology to ensure the patient safely. One avenue for reducing risk is to invest in the further research into a long-term effect of the prolonged EMF exposure. By conducting comprehensive studies that span the extended period and involve the large sample size, we can get the more conclusive evidence on the potential health impact. This research should specifically focus on the individual with a prolonged occupational exposure, such as a healthcare professional working in the close proximity to MRI scanner, to assess any long-term heart rate accurately. So I think that's all the point that I want to highlight today. Thank you.
Right. It's good to see that both of our panelists will finally be able to see eye to eye. And unfortunately, it looks like we're almost running out of time. But before we wrap up, I would like to highlight some of the main key takeaways of this discussion. There is a lot of misconceptions surrounding electromagnetic waves in medical applications, although the risks are there. However, potential benefits far outweighs the negatives. Having said that, a lot of improvements can be made to the existing technology in order to further minimize the risk while at the same time gaining the public trust in the technology. Right. So thank you for tuning in to today's forum discussion. And I hope to see you all in the next one. All right.
All
See
right.
ya.
Thank you, Mr. Azim. Thank you, Mr. Rusi.
Thank you, Mr. Ahmad, and thank you to Mr. Zin for inviting me
All right.
today.
Thank you all too.